This is Dr. Derek Mahony, and I'm very pleased to say that this week is Sleep Health Awareness Week. And what I would like to draw your attention to is an article that I've recently had published with my colleague Roger Price, where I discuss mouth breathing in children and what effect it has on their sleep, and also how it could promote formation of a bad bite or a malocclusion. This is published in Dental News, and I'm happy if anyone is interested to send them an actual copy of the article. The other thing I would like to draw people's attention to is this fantastic book. It's recently published and it's under the category of respiratory medicine. It's published by David Gozal, who's one of the editors, and it's basically called Sleep Disordered Breathing in Children. And what I love about this book, it doesn't just focus on sleep apnea. In the past, too much attention has been put on OSA. And what we've got to realize is OSA is just one of the comorbidities associated with sleep disordered breathing. And you may not have sleep apnea, but you may have upper airway resistance problems, which means you can't breathe through your nose, you mouth breathe, which is also going to affect your sleep. So if I could just quickly guide you through this book. I mean, I've read it from cover to cover, and it's a fantastic read. But if I highlight the chapters that I think would be great for general dentists, and here, unfortunately, I have to put my glasses on. So a good summary of the nasal airway is in chapter 4, Dr. Barudi. We then have a fantastic review of how you can examine the child from an airway perspective in chapter 12 by Harry Bandler. We talk about upper airway imaging and the benefits of using CBCT versus two-dimensional imaging. Big link with obesity and sleep, and it's a catch-22. Children who don't sleep well tend to eat more, and I can happily send you all the papers associated with that. A lot of our children have asthma, and we talk about the link between asthma and sleep apnea. And of course, a lot of the children who are mouth breathers have very poor control over their diaphragm, and a lot of these kids I see have a combination of constipation problems and gastric reflux. Then the big thing that everyone is interested in, what happens to a child after many years of not sleeping or breathing properly? And it does affect their ability to learn, and there's been a number of studies that shows a drop in IQ in these children. Bedwetting is a common problem in children, but not many people link it with sleep apnea. So a fantastic chapter in that regard. My favorite chapter, of course, is from my good colleague and friend, Professor Maria Villa, where she talks about mandibular advancement devices to help open up the airway in these children. So there's a bit of everything in here. And if you look at the contributors, it's a who's who of pediatric sleep medicine. So I really would like every general dentist to get a copy of this book, read it cover to cover. You are the gatekeepers of the airway. And in this week of sleep health awareness, I want people to understand that we can pick up problems in children associated with their sleep when we just look in their mouth. We see the mouth breathers' gingivitis, we see the cross bites, we see the gummy smiles, we see the tongue ties, we look at Malocclusion, all the things I've gone through in other YouTube videos. So to summarize, it is Sleep Health Week awareness, and I'd like you to look at the chapters I've outlined in this book. I'd also like you to read this article. I'll send you a copy of this article if anyone is interested. My email is info@derekmahony.com. It should appear at the bottom of this video clip. Thanks very much for listening, and I hope you get a lot out of reading these chapters.